So again, Dr. Paul deals with the whole person, and the Neuro Emotional Technique that he used, again, is dealing with the emotional side of the brain, not just the physical body, but the emotional part. And a lot of times people will suppress emotions that they have that may cause stress in the body. So he does deal with that side of it. He does a lot of homeopathic remedies, and believe it or not, it does work. So if there's something that you're dealing with, he does go through a series of steps that takes you through that process of dealing with that particular emotion that you may not even know that you're carrying, or even know that your body is dealing with it in some kind of way. It could be something as far back as your childhood that you may have resolved, but your body may not have resolved it, or your brain may not have resolved it. It's still in the filing cabinet. So he definitely deals with that side of when he does the treatment.
I think a lot of people would struggle with understanding it in the sense of believing that it actually works. And I used to work a lot in Asia and overseas, and have a little bit, I guess, am a little bit more predisposed to just maintaining an open mind to some of those things, in the sense that I don't mean to pinpoint it to that, but there were similarities of things that I was recognizing, and it's hard to explain what it does for you, because if you are a skeptic about the testing and the results, you won't recognize the result. You probably won't even do it. But if you're not a skeptic and you give it a try, put it this way, there was a part of it 3-4 months ago that we were doing it, and he brought up a certain question, like, did I struggle with this particular issue? And at first it, no, of course not, and then I thought about it, wow. I came back to him 3 or 4 months, and part of my, hey, I want to go revisit that thing. And that was not too long ago, and it was one of that was one of the most significant appointments or changes that I've had in my whole day-to-day, how my quality of life is, to be honest with you. It just lightened my load, if you will. All the monkeys on my back ran away. And that might be a bit embellishing, not far, but it's really powerful. But you kind of got to just trust it, Dr. Paul is not a traditional doctor, but he has been, and he just knows what he's doing. He can fix you. Well, actually, no. He says he can't fix you. He can put your body back to doing what it's supposed to do, which is fix itself. Which I really like that philosophy. So I was expecting, here's a maintenance plan. I'll crack your back. I got everything but that, and I'm feeling great.
I've always associated pain in my body with being, it's either a muscle issue, it's a joint issue, ligaments, tendons, and I shouldn't be surprised that the mental aspect of it, that those same sort of pathways that I've always walked down with pain, it's no wonder I was getting the same results. And so Dr. Paul, again, for me, a skeptical person, has continued to incorporate that into my treatment. It's wild, but there are moments where it feels like the pain in my body is emotional. It is neurological. And that, I think, is one of the biggest things that has kept me sort of, to me, the mental aspect of pain has kind of kept me in pain, because that's what I expect my life to be like. And the NET treatments, as I'm starting to understand them, are an opportunity for me to address strongholds of pain, whether they're in my joints, in my muscle, tendons, whatever, but also in my head, to reframe what my pain is, where it might be coming from. And as a creative person myself, I feel like it is sort of the secret sauce